Thank you all for coming to our 3 p.m. session today for our 17th year of Online Libraries Conference. And we're very glad today to have our Memory Circle Partners with Alzheimer's Association presentation this afternoon with David Otten and Megan Henderson. David is adult service librarian at Bettendorf Public Library in the Quad Cities. He's worked at the Bettendorf Public Library since 2014. In addition to Memory Circle, David does a lot of programming for adults. And prior to working at the Bettendorf Library, he worked at Alternatives, a not-for-profit social service agency in Illinois, whose mission was to help seniors remain independent in their own homes. So he resides in Moline, Illinois, with his wife and son, and enjoys digging through record crates and increasing his vinyl collection. So that's a great thing there. So and Megan Henderson is currently a senior program manager at the Alzheimer's Association. As senior program manager, she oversees all education programs, support groups, volunteers, and care and support for all affected throughout 45 counties in eastern Iowa. So she's been with the Alzheimer's Association for 5 years, and prior to that served as executive director of a senior living community in Dubuque. Megan is a graduate of Wartburg College in Waverly, Iowa, and graduated degrees in communication arts, religion, and leadership. She's served as a marketing co-chair for the Dubuque Walk to End Alzheimer's and Dubuque Days of Caring Committees as a volunteer at the Quad City Animal Welfare Center. And she serves on the Wartburg College Alumni Board and volunteered at Augustine Lutheran Church and lives in Moline. So glad to have you all here. So, with that, I think we're ready to go. Remember, put any questions you have in chat. Share your time. Thanks, David.
Yeah, good afternoon, everyone. Thank you for joining us for our session here about our Memory Circle and the Bettendorf Library's partnership with the Alzheimer's Association. So hopefully it's really informative for you all. Megan and I are going to bounce back and forth here a little bit, but I am going to, as soon as I can advance my slides, there we go, start with a little bit of an overview of what we're going to review in our presentation today. So Megan is going to start us off with some demographics, some facts and figures about how many individuals are impacted or living with Alzheimer's or related dementias, their caregivers, and things like that. We're going to discuss why Memory Circle, and we will, she'll be reviewing some of the benefits of socialization and social engagement for individuals that are living with dementia, and specifically how memory cafes can provide many of those benefits. I'm then going to review some of the history of how we came to start this Memory Cafe, which we call Memory Circle at the Bettendorf Library, and talk a little bit about the program structure, how we set it up and run it every month, what it looks like. So if you were to, maybe you want to start one of these at your library, you can learn a little bit from our experience so far. We're then, since this is a conference about partnerships, talk about some of the benefits that each organization has seen from this partnership. Megan is then going to talk about how you can connect with the Alzheimer's Association in your area, and the many ways that they assist and help individuals that are living with dementia and their caregivers. I am going to finish things off with sharing a little bit of the things that I found in my research when we were kind of getting started on this journey. Some resources, that you can find for, coming up with some services for people with dementia in your libraries. So I'm going to hand it over to Megan here.
Great. Thanks, David. So I'm going to get started with an overview of some facts and figures. So more than 6 million Americans are living with Alzheimer's, and over 11 million Americans are providing unpaid care for those people living with Alzheimer's or related dementia. So that's family members, friends, neighbors. All of these individuals are impacted across America with Alzheimer's or related dementia. In Iowa alone, there are 66,000 individuals living with Alzheimer's disease that are over the age of 65, and 73,000 care partners are caring for those individuals. So in all of our communities, Alzheimer's and dementia affects many of us, and worldwide, the numbers are staggering as well. So we'll just take a quick overview of some of the other statistics on this page. These facts come from the 2022 Alzheimer's Association Facts and Figures report. So each year, the Alzheimer's Association comes out with this report and looks at the prevalence, mortality, caregiving, and cost of care statistics in our country. So we know that 1 in 3 seniors dies with Alzheimer's or another dementia, kills more than breast cancer and prostate cancer combined. More than 80% of Americans know little or are not familiar with mild cognitive impairment, which can be an early stage of Alzheimer's. So what that means for us is that education is a key component of the work that we do. Between 2000 and 2019, deaths from heart disease have decreased 7.3%, while deaths from Alzheimer's have increased 145%. And then Alzheimer's and dementia deaths have increased 17% during the COVID-19 pandemic. One contributing factor to this statistic is social isolation that came with the pandemic. And we're going to hear about the importance of socialization in these upcoming slides as well, and how important it is, especially to those living with dementia and their care partners. So while we all have probably interacted with someone living with Alzheimer's or related dementia or a care partner, or maybe we ourselves are impacted, the disease affects our community as well. And so we can't reach everyone alone. So I'm excited to be here to talk about the partnership that we have with the Bettendorf Library to make sure that we're able to reach more of those people and that we can reach the community together. You can go to the next slide, David. So what are the benefits of social engagement, right? We all know that sometimes we need to have our space and maybe be away from people, but overall being around others is very important, not only to our maybe mental health, but our overall well-being. We all are at a risk of developing dementia, but we know that there are ways that we can work towards reducing our risk of developing Alzheimer's or related dementia, and social engagement is a great way to do that. In fact, at the Alzheimer's Association, we oftentimes talk about 10 ways that we can love our brains, and socialization is one of those. So social engagement is a main component of healthy aging, and it does appear to minimize dementia risk among older adults. Research has shown us that there are reduced rates of disability, mortality, and depression when individuals stay socially connected and engaged with others. The Alzheimer's Association has a public health center for excellence, and through research from that public health center, we know that social isolation and loneliness can shorten an individual's life by an estimated 15 years, and it is also associated with an increased rate of cognitive decline. Going back to that statistic of the increase in deaths throughout the pandemic. We know that social engagement activities for those living with dementia and their care partners provide opportunities for them to connect with others who understand what they're going through. So they don't have to feel alone. They can build connections. We've noticed that the individuals who attend our social engagement activities not only enjoy coming and come more often, as David will share later, but they oftentimes form relationships where they're connecting and staying engaged with one another outside of the organized memory circle, which helps continue to decrease their feelings of isolation or loneliness. And we knew all of this and that there was a huge need in our community for social engagement among those who are impacted by Alzheimer's or related dementia. We have found ways to be successful to close that gap with support groups and education programs for caregivers. However, we still had an open gap in providing those services to those living with dementia. So that is where the idea of the Memory Circle or Memory Café idea came to life. And we can go to the next slide, David. So what is a memory cafe or memory circle? It might look different across different areas based on resources that are available, but a memory circle or memory cafe is an example of a social engagement activity, especially designed for those living with dementia and their care partners. According to AARP, the first memory cafe was created in the Netherlands in the 1990s to help raise awareness and to fight stigmas associated with dementia. And as these groups continue to grow throughout our communities, through partnerships like this one that we'll talk about today, these groups continue to grow, and we see the benefits of bringing those living with dementia and their care partners together. The key is that they come together. So this is an opportunity for not only an individual living with dementia, but also the person that they're caring for to maybe form partnerships and relationships with other people going through those similar situations. And as continued research shows, the importance of social isolation, social isolation, and loneliness have those negative effects on individuals, there's even more need for social engagement activities. So the memory circle that we have really focuses on having fun. David will talk a little bit more about our structure, but we've received that feedback of people coming together, maybe getting outside of their comfort zone with some of the activities that we have, but really just there to have fun. It's not a place to talk about the struggles or challenges that are happening. It's a place to come together as one, knowing that you have similar situations. But another benefit is that no one has to mention if they have Alzheimer's or dementia or what type of dementia they have. And oftentimes it's hard to tell who is the care partner and who is the person living with dementia, depending on what stage of the journey they're at. But we have received feedback from those who've attended, and the services have only had a positive effect on their lives. And so because of these benefits, the partnership between the Alzheimer's Association and the Bettendorf Public Library began. And I'm going to pass it back over to David to talk about the history of that relationship.
Okay, so I'm going to share a little bit about our road to the Memory Circle and how we came to get there. Megan talked about some of those early origins of the Memory Cafe earlier, but for us, it began in 2018 when our administration went to ALA, and some of them went to a presentation called Make Your Library Dementia Friendly. And as oftentimes happens after conferences, people return full of ideas, and we start to have conversations. We started to have conversations about what would this look like at Bettendorf Library. They brought me into those conversations, knowing about my work history with seniors and many of them, who were living with dementia in the past. And so we started to talk about what that might look like. I started a little bit of research again, which, I'll share what was going on at other libraries, what sorts of things might scale to Bettendorf. It really started to begin taking shape as we were doing our 2020 to 2025 strategic plan. The demographic research for our strategic plan identified 55 to 74-year-olds as a primary service population for us. And one of the things that really stood out to me at that time, nearly 30% of our population was 55 or older. So, we knew that we had a population here, based on some of the demographic statistics that, Megan shared at the beginning, that there was likely a need for some services for people with dementia in our community. One of the other things is you're doing your strategic plan, you're looking at your mission statement and your library's vision and values and things like that. And ours, I'm not going to repeat it verbatim, but mentions we're committed to providing access to information and ideas for all. And our vision and values invoke things like access, lifelong learning, community, and providing services for patrons that are living with dementia, their care partners, really is kind of where we decided to embody some of those values, with some of the services we provide. So as I'm beginning this research and I'm looking around, seeing what's available in our community, are we going to duplicate anything? I noticed that the Alzheimer's Association had, in addition to their support groups and many other things going on, that they had a Memory Café meeting that was being held at a senior center in our area called KSI. And I reached out and shared some email back and forth with Megan and some other people at the Alzheimer's Association at that time. And they invited me to come to their December 2019 meeting. And I sat in, and at that time I was just kind of observing, okay, what do you do? How does this work? How would we do this at the library? What types of activities work? And I stayed afterwards and I chatted with the volunteers who were leading it, Sam and Jen. You'll get introduced to them here in a little bit, to talk to them about their experience in running it and things like that. And I'm thinking, okay, I'm taking notes and I'm thinking, okay, how am I going to do this? Then they approached me saying, what would you think about doing this at Bettendorf Library? And so we started to have a conversation about what that might look like. And we met up in February of 2020, and we, started to talk about what sorts of resources the library could provide, meeting rooms. I have my Rolodex of performers that I bring in, musicians, artists, other sorts of things, that we might be able to provide. We have, as many libraries do, stacks and stacks and stacks of craft materials, which, caused Sam and Jen's eyes to light up a little bit. Then we all kind of know what happened next. So as we were making plans to get started, so did the pandemic. So things got put on pause for a little while. But then, as fate would have it, we were kind of getting started, thinking about starting, our in-person programming, hybrid programming, like what this gradual opening up would look like at about the same time. And, Jen and Sam, our volunteers, had reached out to me again, and we decided to get things going in September of 2021. So we've been meeting monthly since then. And this is a little bit of what our regular schedule looks like. So we meet the last Tuesday of every month. We wanted to pick a time that was, going to be memorable, and, picking a first day or a last day of the month seemed to be the way to go. So we started our first month, we had 4 people in attendance. And that's grown every month that we've done it. We've had at least 2 new people show up every month, and not everybody comes every month, but we usually have an average of about 12 people in attendance every month. And that's been really great. It seems to be the size that worked. We talked when we began that, book discussion size was really going to be kind of ideal for this program. We started out at 1 hour. We were doing from 10:30 to 11:30 in the morning. But really, it became apparent that people just wanted to stay around and chit chat and socialize afterwards. So we just extended it to 1.5 hours, you know, and that's really worked out pretty well. A lot of times people will, you know, at the end of the meeting, they will sit and catch up. Some of these people, as Megan mentioned, know each other a little bit from other support groups. They've ended up forging relationships outside of the memory circle, outside of the outside of their support group, and that's actually a really rewarding thing to see. Getting ahead of myself a little bit with the benefits, but that's really nice. So I bring in some coffee, other refreshments. Jen and Sam will often think of, you know, we'll bring some coffee cake, or we'll bring a themed snack or things like that. They're always thinking up a theme for the month. One of the funnest things that they did when we first started out was we had a Halloween candy corn tasting. They brought in all these varieties of candy corn, and we all tasted which one. But we'll just sit there and socialize for a little bit. You know, we sometimes our conversation starter is a little bit of trivia. You know, sometimes it's just catching up. What have you been up to since last month? And people will talk about what's going on in their household, or maybe they went on a trip, or things like that. You know, and then occasionally we'll do something kind of special for the month. We did a picnic over the summer that went really, really well. We're very fortunate at Bettendorf Library that we have an area to the south of the library that is called Faze Field, and we have a nice little area with picnic tables and things like that. We had lovely weather. You know, I brought in a musician on a couple of occasions. That's really, really gone very well. People have always enjoyed the music. Next month, we're bringing in, or actually not even next month, next week, we're bringing in a physical therapist that's going to kind of lead the group in some light exercises and talk about the importance of staying active and things like that. So we've been able to, with the library's resources, kind of add a little bit of value, I think, to the group that way. So we're going to talk a little bit more here in the next slide about the benefits of the partnership. And I'm just going to continue here and then hand it over to Megan. But from our perspective at the library, the thing that we really get out of this is the Alzheimer's Association's expertise. Their branding, they're a recognized name. People know and trust them when it comes, you know, to dementia-related matters. And Megan often comes when she's able, and so she's there if anything comes up, somebody needs resources or referral or something that's out of, you know, my area of expertise as a librarian. But we have their literature and things like that on hand. You know, and then the other great thing that we got out of this is the volunteer social engagement facilitators that were trained by the Alzheimer's Association. You're going to meet them on the next slide, but Jen and Sam are two of the best people. They have seemingly boundless energy for this. They really keep the group engaged and going. They're full of ideas and just you know, just a real joy to be around. I'm a bit of a introvert, and to do what they do, I would be exhausted. I would need to go nap for the rest of the day afterwards. So it's a benefit for me as well as you know, our attendees who have a much better time with Jen and Sam leading the group than they would with me. So I'll let Megan talk a little bit about some of the benefits that they see from their perspective.
Yeah, so there are a lot of benefits to partnering with the library. I think first of all, we were struggling. Jen and Sam and I had been working together to try to get this memory circle up and running, having a hard time finding that safe space where people felt comfortable going. And so the library just seemed like that great space, right? Everyone goes to the library. They feel safe there. They know that they can get resources there. So that was number one. And then also having more resources available for planning. We are limited on the funding that we had and the resources that we had to be able to provide the activities. So Sam and Jen and myself were paying for that out of our own pocket sometimes to make sure that we had those activities. So David, being able to have those resources to what the library has, and especially the outside speakers and the entertainment really helped. Being able to also incorporate some of the memory kits that David had at the library and to have them available for people to know that there are resources in addition to books that they are able to receive at the library and take home and help them continue to really keep their brains active and keep working their memories. We're also able to reach more people. So we're able to send this out to our network, but really it's so much better to be able to work together to promote this program to both of our networks.
Yeah, I would just like to reiterate that you know, we do promotion in-house, obviously, in the library. We do it on our website, our social media, you know, our bi-monthly newsletter. But a lot of the people that have found the group and found our library, you know, have found out about it word of mouth at Alzheimer's Association support groups or through their newsletter or, you know, things like that. So we've had people that wouldn't be coming to our library otherwise coming into the library, which is great for us. You know, we're a public library. We want people, you know, coming through the doors. So we want to see people. We want to help people. We want them to think that the library, you know, is a place that they want to be. You know, this is. The Alzheimer's Association's network has really helped us reach some people that we wouldn't, and the turnout is revealing that, you know, this is a place that people want to come, and this is a thing that people want to come for. Of course, the best benefit is when you're getting positive feedback from your community and the people that are coming. So to me, that's the number one benefit. And here you see Jen and Sam dressed up as for Halloween just a few months ago as Laverne and Shirley. And I think you can see from the picture, you know, they are like this all the time, just beaming, happy, a pleasure to be around. I can't say enough nice things about them, but you can see some of the feedback that we've gotten from participants and from our community. The top one was really, to me, the most significant. You know, somebody mentioned that giving them the pleasure of being together each month, and it's so wonderful for them to be able to get together and share the moments, no matter what we're doing. This is from one of the care partners, and was a note that they sent directly a couple of months ago. And you know, we talked about earlier about the benefits of socialization and things like that. One of the things that I notice is how much this is really important for some of the care partners. It's not support group where they're talking about some of the more difficult things. It's time to have fun, and it's time when they're enjoying being around other people, you know, enjoying their spouse or parent or, you know, whoever it is. And just for me, a personal benefit it's a really rewarding thing to see and a rewarding thing to get to be a part of. And this group and some of the memories that I have from this group are something that if I'm having a tough day, something didn't go right at the library on the reference desk or whatever else downstairs, this is one of the things that I reach for that kind of, will get me through the rest of the day. So it's really, beneficial to me personally as well, I guess is what I'm trying to say. Megan is next going to review how you can get in touch with the Alzheimer's Association in your area, and the number of ways they help individuals living with dementia and their care partners.
Thanks, David. And I have to echo you. I think some of my memories from the Memory Circle are get me through those tough days, and also just being around Sam and Jen gives me a positive attitude as well. So the Alzheimer's Association, we serve anyone across the state. We cover also 5 counties in Illinois as well. But we have staff available 24/7. We are part of the National Alzheimer's Association that helps us provide this benefit to individuals. So anytime that someone needs connected to resources in their community, perhaps they've had a difficult day and they need to talk through a situation of understanding the behavior of an individual living with dementia, or maybe there's someone living with dementia and they need to find resources in their area or talk through the grief that happens after a diagnosis, or even just to be connected to support groups and education programs in their area. Our helpline is available around the clock. So 800-232-3900. Someone is always there. We also have social workers, master's level clinicians that are there to offer confidential care consultations, as we call them. And we have the ability to have these conversations in over 200 languages. So being able to provide assistance and care to those who need it, no matter what their language, no matter what time of day. We also have free education that we offer. So at alz.org, or more specifically alz.org/Iowa, that's more of the local programming that we have happening. We have anything from virtual education, going into communities, going to libraries to provide education to the community, to staff on a variety of topics, from understanding Alzheimer's and dementia to knowing what healthy habits are and how we can reduce our risk of dementia. And then our Alzheimer's Association and AARP Community Resource Finder. This is a place where individuals can go to look for programs, support groups, social engagement groups like memory circles or cafes, or find resources like assisted livings, long-term care communities in their communities as well. So they would go in, type their zip code, and be able to pull up resources in their area. So all of these resources are available. All of them are free for individuals to access. Almost 100% of our programming is free for individuals to attend. And know that if anyone wants local connections to their care and support team, there are 3 of us across the state. They can always call that helpline and request more local follow-up, and they will connect you to one of us.
Okay. So lastly, before we do question and answers, I wanted to just share a few of the things that I found helpful at the start of our journey, and actually refer back to. So first is Dementia Friendly America, and you can find them at dfamerica.org. They have a number of resources. They're a guideline seeking to ensure that communities, entire communities, support those living with dementia. And so they don't just mean, the library or whatever. They have guides for, airports, restaurants, everything. But of relevance to us, they do have a sector guide for libraries that you can find on their page that has some tips and things like that that you can do to make your space more dementia friendly. One of the things that we chose to go with, obviously, was starting the Memory Circle. The ALA, of course, is also a very good resource, and they have a great page that has resources for providing, or very thorough guide for providing services to individuals living with dementia. It has tips, best practice resources for libraries and librarians, guidelines. It has links to some other program models. So one of the ones that we looked at early was this Tales and Travel, which if any of you have looked around at doing this, you might have come across before, but it started at Gale Borden Public Library in Elgin, Illinois. They've got a link to that program and that model and things like that, as well as a series of memory cafes. It's called the Library Memory Project. I forget which region of Wisconsin it is, but there's a network of libraries within a region of Wisconsin that actually run memory cafes, and they rotate which branch and things like that it's in. So that's a great place to look to. And then if you're an ALA member, there is a library services for dementia and Alzheimer's interest group that you can join, and they maintain a listserv as well. I don't think you have to be a member to be on the listserv. That's one of the places, like most listservs that I'm on, I just kind of lurk, but people are occasionally posting there about what's going on in their library, sharing tips, encouragement, and things like that. So we're slightly ahead of time, which means more time for questions and answers. And I'm told that somebody else is going to curate those for us.
Yeah,
hopefully,
Dave, thank you.
Hopefully,
can you
Megan and I have some questions. Or yeah, I can.
Okay, great. Sorry.
Have some answers for you.
Yeah, great. We have some questions, but I think I want to jump from what people are really interested in. First off, those folks that lead these sessions, we had a very nice slide of them there. They're part of the Alzheimer's Association? They're not part of the Bettendorf staff, right? There's
No. Yeah,
okay.
they came with, and they predate so I'm not quite, Megan can tell the story of how they came along with to Jen and Sam, but.
Yeah, so they were Alzheimer's Association volunteers that we trained to be social engagement facilitators. We had been approached with them, we had been connected with them and trying to get this group started. So when we approached David about that, so we trained them, they were ready to go, and then it just worked seamlessly to transition them.
So they are volunteers, I think that was the question. And this is intended for patients and caregivers, right? That's what, I mean, that is encouraged. I mean,
yes.
That would kind of have to be correct. Okay.
Yes.
Then there's a whole lot of chat about the memory kits. And can you just give a quick synopsis of how those kind of operate?
So I will have to probably say that if you need the information on the company where we've bought them from, I don't recall it off the top of my head. I will have to get that to you later. But basically what they are is we've bought a number of reminiscence kits. We circulate them. They come packaged for the library in a plastic case. And there's a variety of themes. One of the ones that comes to mind that we got that actually other Iowa librarians are probably interested in was a farming theme. And so you open up the kit, it's got a DVD in there. It's got some flashcards with pictures and things like that on them, farm animals, bales of hay, people, tractors, things like that. And it's got kind of a guide in there on how to use them as prompts to kind of start conversation. So I think Megan will back me up here, but the idea is that, you know, many people that are living with dementia, it starts to impact their short-term memory first. Images, things that they remember from work, from childhood, or things like that still remain, you know, pretty powerful, you know, for a long while. And so sometimes those basic flashcards are ways to kind of prompt people to open up to talk and things like that. Those were pretty successful. We just recently added in some reminiscence kits from the same company that are meant to be geared towards people that are in the later stages of dementia. And those are much more tactile, fidgety, you know, things like that. They have these bottles in them that you can kind of rotate and that have a number of objects and things like that in them. So again, I should have written that down so it would be top of mind, because I should have anticipated being asked that.
They were listing mentality as one. Is that one?
I
They
think
put the link in
Me
the
Eternally,
chat.
I think, is the name of the
Me
company.
Eternally is
Actually,
someone?
yeah.
Okay.
Now that you mention it, I think
Me,
I found them
Me
just
Eternally. I'm sorry.
yeah, Me Eternally. Yeah,
Yeah, that's
I
what
think
it
I
is.
just and to be honest, I think that's how I came across it. Is I just Googled and was like, oh, cool, here's this thing, and asked for money to buy
they
them,
have
and
like
we did.
Yeah, clear black backpacks with stuff.
Yeah, they
those,
have
yeah.
they have all sorts of stuff, and it's the nice thing about it is that it's packaged and ready for the library. Like it's, you know, it's already built to circulate. You don't have to find anything else. So
yeah, the finding would be tough. They said they also do photo books as well, kind of that sort of
I believe
assist.
so.
Yeah. Mm-hmm. And Penworthy, is that a name we're seeing that come up? Is that another one?
That one I'm not familiar with.
Penworthy was
so
okay. Yeah. Do you do outreach to local retirement or assisted living places for this as well?
So we haven't taken this program on the road yet. We do have an outreach person that takes deposit collections to some of our area assisted living facilities or senior high rises and things like that. We've done some programs in there. We've done, you know, and it depends on what. We've done, like kind of a technology petting zoo and things like that, where we've taken smartphones and tablets and things like that. And we've not taken the memory circle on the road. We have been approached by an area assisted living facility that wanted to fill you know, the van up and bring people to the program. And we had to have a discussion as to like that for what this program is intended for. That might have gotten a little overwhelming if we went from having, you know, 10 to 12 people to all of a sudden 30 in the room, or, you know.
Because that kind of addresses it, because another question, because they were wondering if you can do this outside the library and you just.
Yeah, I think you could do it really anywhere, but I mean, I think we've come to find that inside the library is really ideal. We've got, you know, the meeting room space. People know where the library is. Typically, they feel comfortable coming to the library. But I don't see any reason why we couldn't do something like this at a facility or things like that. Excepting to say, many of them do have their own program and activity directors that are, you know, paid to do this type of thing.
Do you think the ideal number? That's a question they're going to say. You know, around 30. I mean, would you want to do?
I think that would.
What do you think?
I think 30 would be getting too many. you really, it's seeing those one-on-one connections is really important. I think the ideal thing for us is, like I think I said earlier, is about book group size. So, 12 to 15, if we were getting over that, I think that's something that we would want to take a look at. Maybe we need to offer another time, or, do we need to offer in another location? I should say too, in response to it, we have had several assisted living facilities open up in Bettendorf within the last couple of years. It's really been a growing part of the community. So we started a new program that's just started that's called Coffee and Conversations. And it's going to be typically like this, not necessarily geared towards people living with dementia and caregivers, just anybody that's living in those communities. And we're advertising it specifically with those assisted living and senior high-rise facilities. So that's kind of been our approach to kind of try to meet that need. So that's brand new. I think we did it for the first time last month.
Someone was asking about the times of these sessions. Do you think it works better given the morning versus afternoon?
It's worked well for us in the morning. That it seems to be a good time. It's a great time to put out coffee and donuts, and which are great great things to socialize around. So
I'm just wondering, people working about people not sundowning and that sort of thing, do you find it more effective? I think that was.
Yeah, absolutely. I think anything that you can do in the morning and avoiding the afternoon hours is very beneficial to those living with dementia.
They're already thinking of that. So do you have any good book publishers they're asking about this? Or we already talked about them. Do you have any, besides the publisher, the place we already talked about, do you have any sort of books or materials, something to ask you? There's probably a lot.
I mean, there's a lot out there. I had heard tell, but never came across anything about people that publish books that are specifically intended for people with dementia, because I'd seen mention in various places, but never found an actual one of people that do a book group for people with dementia. But specific publishers or books or things like that, I don't know. Megan may have
specifically asking about books that can be read to folks with dementia. Okay. I guess. Is there such a thing you could kind of?
Yeah, I think there's another comment about photo books. I think oftentimes just finding photo books or books on certain topics are really good to read to those with dementia. The most important thing is finding something that the person living with dementia finds valuable. So if they like farming, like David said with those memory kits, then finding a book about farming and reading that to them. If they are whatever they find valuable in their life or what they did growing up, being sure to incorporate that. But I don't know specifically about specific books to be read to individuals with dementia.
Do you have anything about running these sessions with your social time, the social interactions? I mean, do you train them on ice-breaking, facilitating? What do you recommend for volunteers for that?
So with our social engagement volunteers, we give them handouts of sample activities that they could do, sample icebreakers and ideas. But Sam and Jen just go and find the trivia on their own. Oftentimes they'll use that trivia as that ice-breaking time, but the socialization time at the beginning is often just self-led by those caregivers and those living with dementia to talk about whatever they want to, making conversations about things that they did in their week. It's very informal. But other than the icebreakers that we give ideas for, Sam and Jen happen to be rock stars. We wish we could duplicate these volunteers in all areas, but they go and find that information on their own. Anything to add, David, to that?
Yeah, no, it's just, it does, and maybe we've been fortunate that way, but since we've been having it at the library, the conversation happens to just be pretty freewheeling. People show up and just start talking, and sometimes, we've found, we had a plan or an agenda, and we've been just chatting back and forth with everybody for a half hour, 35 minutes before, we realize, oh, well, we had this other thing we were going to do today, so.
Do you have any thoughts on good resources for caregivers who are going through that, who are, I know the sessions aren't really for that, but someone's recommending the 36-hour day as a book, or is that, do you have any thoughts on that specifically?
That's a really great book. The 36-Hour Day, Creating Moments of Joy by Jolene Brackey is also a really great book for caregivers. There are a lot of good resources. I would say those two are the ones that people make comments about most often. But Alzheimer's Association also has some of those listed on our website as well. Also for male caregivers, Coach Broyle's Playbook is a really great resource. It breaks down caregiving through the stages of dementia, and also just in a very simple and easy to understand approach as well.
Do you do any, will your association do any training for volunteers?
Yeah, absolutely.
Cool.
Yeah, absolutely. Awesome. Yep. So if anyone is interested, they can reach out to me. We can make sure to connect you to the care and support member in your area. We can talk about what that means to train individuals that are interested in doing that as well. And another resource for caregivers is we have support groups that happen across the state, and some that are still happening virtually as well, just specifically for caregivers. So that's a resource where they can go and attend that group and have more of those conversations about things that are going well, things that are not going well, and finding more of a connection with other care partners.
Fantastic. Well, I think we're at time, and we've had such good interaction, but I really appreciate everyone coming in here today.